Joining me now is Dr. Ramin Oskoui, cardiologist, CEO of Foxhall Cardiology, and Dr. Yvette Lozano, owner of Lozano Medical Clinic in Texas, who's treating her patients with hydroxychloroquine. Dr. Oskoui, let's go to you first. Does all of that fall under the purview of the CDC?
I suppose it must. The House Appropriations Committee keeps giving the money. But I think the pandemic was really a stress test, one that the CDC failed. And I think it's because they've been resting on their laurels since the 1940s and 1950s, and we've been keep giving the money. And I think that's something that's got to change.
Dr. Lozano, the Lancet, when people hear the Lancet, it's like the JAMA, the Journal of American Medicine, whatever it is. But that's the big, these are big publications. And when the Lancet criticizes Trump, what should we think?
We think that the medical journal has gone political, and so we cannot justify their results anymore as legitimate medical research.
And Dr. Lozano, really quickly to you before I go back to Oskoui. The president said today that he's using a particular drug as a prophylactic against hydroxy. This is what he said.
I'm taking it, hydroxychloroquine. Right now, yeah.
I was just waiting to see your eyes light up when I said this, but when I announced this. But I have been taking it for about a week and a half.
Every day?
At some point, every day. I take a pill every day.
Dr. Lozano, people on television, news anchors, guests, were freaking out about this. What about this should we, the American people, know? Is that irresponsible of him to be taking hydroxychloroquine, and why do they care?
I think the people of the United States need to know that they have a brilliant president of the United States and that he wants to keep himself safe and healthy so that he can guide us through this pandemic. He's done an incredible job. He is saving thousands and thousands of lives, and I commend him for coming out publicly and sharing with his people that he is taking this drug, that it is completely safe, and that doctors need to start prescribing it immediately.
I know they're taking it, Dr. Oskoui, in places like Turkey, which has made it basically free of charge, of national health care, to everyone. Australia, there's been pushback. There's been some conflicting studies for sure. But taken early or at a moderate point in the disease or even as prophylaxis, that is being seen with some benefit so far, but the studies are still coming in. Nancy Pelosi said this about the president's decision. Watch.
He's our president, and I would rather he not be taking something that has not been approved by the scientists, especially in his age group and in his, shall we say, weight group, what is morbidly obese, they say.
It looked like Anderson was smiling there. Dr. Oskoui, since Pelosi doesn't listen to the facts, can you spell it out for her here? Is the drug safe, and is he right to take it as a prophylactic?
I think that the drug is clearly safe. Looking at the package insert for Plaquenil, the branded hydroxychloroquine, there is no cardiac monitoring prescribed by the FDA. It's been used for decades, safe with no cardiac monitoring. With the few studies you've seen are sloppily done where they don't control for electrolytes and other antivirals. I think the critical aspect here is it's very reasonable. In India, for instance, there's a whole protocol of using prophylaxis, this drug as prophylaxis in healthcare workers. It's being studied in Spain for that reason. There's a lot of good reason to think this drug works, from the molecular biology with coronaviruses back in 2005 to even data in the last 6 months. I think if I had problems with COVID-19 and the air conditioning of the White House like he did 10 days ago, according to Dr. Carson, I'd probably take it too prophylactically.
Dr. Lozano, the medical establishment went crazy, though, over this announcement. Watch.
I'm not aware of an evidence base that would indicate that it's effective for this indication.
There is no evidence that tells us that taking hydroxychloroquine is either safe or effective.
He shouldn't be taking it. There's right now, to be clear, no evidence that it works to treat this disease.
Dr. Lozano, what do you know from prescribing it that these doctors don't?
Well, I'm not sure if those doctors are actually seeing patients or they're just high up on the scale of the bureaucracy. So what I would tell them is come over to my office. Let me show you what it does. And so I believe that this drug is life-changing. It is incredible how quickly it works. I think that we should look at Turkey. They're making it available to everyone. I still am having problems with CVS not dispensing this medication. Today, a pharmacist at CVS, Ty in Haltom City, refused to give my patient this medication, which I even mentioned to her, the President of the United States is taking. And so we need to very strongly about making an executive order lifting this, mandate by the pharmacy board so that all patients that have this medication given to them by their physicians can obtain it without any difficulty. I commend President.
Yeah, Dr. Oskoui, I mean, my concern is that, look, people should be monitored. I know you monitor all your patients, both of you do. But, I mean, I think people aren't getting it when perhaps, I say perhaps, I'm not a doctor, it could actually benefit them. And it's very safe. Again, be under observation.
I think
Laura?
that's exactly correct, and her experience is my experience. The problem is a lot of these major medical centers are trying to force patients into clinical trials, which they happen to make huge amounts of money on. Hydroxychloroquine has outcomes data that's very favorable in France, in Italy, in China. There's a reason why several countries confiscated the entire national stock. France did this in late of March. So I think that we shouldn't have pharmacists or doctors that have a secondary gain blocking physicians from working in a patient-doctor relationship as we've done for decades.
All right, Dr. Oskoui, Dr. Lozano, thank you so much. And I should say George Washington University Hospital group or hospital center has also put out a new protocol, basically warning about hydroxychloroquine, citing that New York study that came out last week. That was later stage patients, which is not when people would indicate you should take it. All right, coming up.